informational hearing on the statewide mental health listening tour and its key themes. We have Lynne Saxton. And I think this is kind of a preview of a longer presentation we'll probably have later.
Yes. Good morning, Chair Gelser, members of the committee. We're very excited to be here today with a preview of the behavioral health tour that Senator Gelser and I and members of the Oregon Health Authority team, many legislators, many providers, and most importantly, many consumers in Oregon's behavioral health system participated in over the last 6 or 7 months. It's been an eye-opening and very helpful process for all of us. I think for me personally, and I think for many others, was very moving in terms of what we learned is top of mind for people being served in the behavioral health system across our state. So I don't know. Oh, there we go. So the tour, I want to underscore that when Senator Gelser talked to us about this work, one of the things we wanted to ensure that we did is both cover the state geographically, and as you can see from this slide, we had surprising attendance throughout, beginning in Klamath Falls in September. At OIT, we had 98 very engaged attendees, and you can see LeGrand, 77 people showing up in LeGrand.
That on a Friday night when there was a football game.
Exactly. Amazing. Bend, Astoria, again, when you see in Albany that we had 156 people, these were vibrant conversations, well attended, and it's important to underscore that we made an effort throughout in structuring our process to ensure that people could speak, and it wasn't about providers speaking, it wasn't about Senator Gelser and I speaking, it was about them speaking candidly and comfortably about what's really working for them in their lives and what challenges they face and what we can do to foster improved care and life experience for them. I want to underscore, because I'm really excited about this, we did a virtual session on December 14th, which was a virtual town hall with people calling in. It had this phenomenal AT&T employee who made sure virtually that everyone could speak, and it was really a great innovation on the part of the state of Oregon, and particularly because, first of all, for some people with behavioral health issues, being able to talk about their issues without being visible, and even though their voice is coming forward, they don't have to go somewhere if they have disabilities. They also don't have to take on that sometimes painful process of sitting with other people and talking about very sensitive issues. So that was attended by 32 participants. We actually had a lot more sign up, and the Health Authority itself is looking at using this approach in the future to capture member information.
And Lynn, if I could just add, what was remarkable about that AT&T employee, everybody called in, so it really replicated what we had done in person, where you had the small group conversations and then coming back together. So people broke up into these virtual rooms where they had small group conversations with a facilitator and 3 or 4 people, and then the whole big group would be brought back together again. It was, and the employee, we all wanted to take him home. He was so comforting.
Great. You're right, Senator Gelser. Thank you, because that was the strength of the format. This is a map of where we went in the state as a 7-year resident of Klamath Falls. I just want to point out, when we scheduled these trips, I was called and someone said, "Why are you going to Klamath Falls? It's not in Southern Oregon." So it's important for everyone to see on the map that Klamath Falls is in Southern Oregon. Just have to say that. Okay, one of the things that I think produced a remarkable result was a lot of work on the front end, a lot of vision by Senator Gelser, and a lot of collaboration around how do we make this process not a complaint session, not a this kind of a traditional, I need these things and we're not getting them, but how could we start with strengths-based practice with this population and say, tell us what's working for you? And those conversations were very poignant. I was sharing with one of my colleagues this morning the fact that people often said what they were most hopeful they could get in their lives were friends and social activities. and anyone who's worked with behaviorally health challenged folks, oftentimes their circle of social contact gets very small and isolated. Secondly, they talked a lot about the importance of employment for them to have a quality of life that they expect, and other supports as well. So this is the question framework we used. We worked in small groups. After Klamath Falls, Senator Gelser and I and others did not sit at the tables to facilitate conversation. Several of the participants said they did not want to sit at tables with either their providers or their therapists or other people because they wanted to have freedom of voice. We worked very hard to achieve that, and I want to give a compliment to our CCO partners and our provider partners who respected members' desire to have space and freedom of speech, if you will, and sat in the room with us, were able to listen, but did not actively engage. So, oh, is that it? Yep, that's it. Okay, so important points about where we go next. This is part of a three-legged stool we have been building over the last 12 months in Oregon as preamble to taking on our behavioral health challenges in this state, including at the CCO and county level, and we're very excited about that work. The first was the behavioral health mapping tool that the Oregon Health Authority began in February, which is a comprehensive data set based in counties in terms of resource allocation and outcomes of our behavioral health system, both in the CCO and the county deployment of those services. That work is underway. The Technical Advisory Committee convenes, which is people from all over the state, from all sectors, to verify and ensure that data is accurate and sound. They meet for the third time, I believe, next week, and will have a completed product in June of this year. That tool will be instrumental in helping us make informed investments for results for all populations in Oregon. And if any of you would like a briefing on the tool, we're happy to do that for you. Secondly, this tour, which we will be bringing forward a report in February. We have a preliminary report, which we were all very excited about. It's going to look a little different. It's going to have a data orientation, but it's also going to really communicate some themes from people that I think are going to be very compelling as we move forward to implement change in our behavioral health system. Thirdly, we have been working closely with the U.S. Department of Justice for the last 7 months. We had hoped to have our agreement by Christmas. That was one of my 2 Christmas presents I wanted. Unfortunately, we're still finishing that up, and we'll have it this month. But that agreement will frame some of the opportunities we have in the next 3 years to advance behavioral health results for Oregonians. I will be delivering to the governor a proposal for a process for behavioral health advances in January, and we'd be happy to share that with you as well once the governor's had a chance to review it. But this is really the cornerstone. I think many of the people who attended these town halls with perhaps a slightly skeptical eye came away really not only impressed, but having a shift in their perception of needs and solutions that we need to get in place in Oregon. So with that, I'll stop. And again, I want to thank Senator Gelser for being on the road. This was a pretty aggressive travel schedule. People were very appreciative. We had senators and representatives. Senator Whitsitt and Representative Whitsitt joined us in Klamath Falls. Senator Knope joined us in Bend. We had a lot of active participation. Representative Greenlick was with us here in Portland. Senator Dembro, I know you were with us as well. So we appreciate everyone's time and effort to produce what I think will be a very critical element of moving forward with change. Thank you.
Thank you. And I just want to commend Lynne, who attended every single one of these. Lynne had a lot going on. You know, the day we went to Bend, she was coordinating responses to Umpqua Community College, and it's been a phenomenal opportunity to get to know Lynne and her team of facilitators, the individuals that went to every single one of these meetings and really engaged people. The feedback from people was that these facilitators made people feel so comfortable. And Cherie, who is our professional facilitator, was also extraordinary to keep the whole thing moving along.
Thank you. Our privilege. Thank
Any
you.
questions for?
I do have one
Yeah.
question. Just, putting on my workforce chair hat, I'm intrigued by the comments about the workforce and the challenges and the desires and expectations. And, at some point, I'd really like to tease those out and see if there aren't some things that we could be doing to make it easier for people to flourish in the workplace.
So, Chair Gelser, committee members, Senator Dembro, this is a matter of very close to my heart, and I have some direct experience working with employers to employ folks with chronic mental illness, and it can be truly transformative, and we look forward to advancing those initiatives. Thank you.
And then when we do present the report, sorry, just one
No,
last thing. When we do present the report in February, my hope is we can find and a room, but we've saved all of the Post-it notes, which I noticed appeared in my office last night.
Oh, no.
There's a box that just says Behavioral Health Town Halls, and it's big and it's heavy, but it's got all of the flip charts with the actual words of people. And what I'm hoping is that we can get a room and have an open house there where folks can come and just get a sense of the words of these folks. And
Yep.
What I took away was this is the real story of real people in our state, and I'm so grateful that they gave us their time.
Yes. Thank you.
Thank you so much. All right, so I'm going to close the informational hearing on the mental health tour. Anything else for the good of the order? See nothing at all. We'll see you on February 1st. Do not plan on a 3-day weekend in February because we need
Ooh-wee.
that day.
Ooh-wee.
Sorry, Senator Olson. And with that, we are adjourned.